And I think we in the SNP benches want to first and foremost put our thanks on the record to our NHS staff. I know that certainly a number of members of my family work for the NHS, and I spent time with them at the weekend. And just, that was time that we got because they were working over the Christmas period. Now, we know that over Christmas and the winter period it's been profoundly challenging in terms of flu, but I think it's important that resources follow that as well, and that's why we've got record funding support for the NHS in Scotland. And NHS Scotland A&E departments are actually the best performing in the UK. But last week the Scottish Parliament voted to abolish the public sector pay cap and to look at bringing in a 3% pay increase for our public sector workers. This is actually, this is action rather than warm words, and I think far too often from this government we hear warm words, but the National Health Service will need to see action on that, particularly on the public sector pay cap. So can I ask the Minister what steps he's taking to tackle wage stagnation within the National Health Service?
Well, I thank the honourable gentleman for the more mature way in which he's approached it in terms of recognising the huge amount of work performed by NHS staff. And indeed, as I pointed out in my remarks, 1,200 more people being treated in A&E a day, which reflects how much more is being done within our NHS, with more resource, with more money, with more doctors, with more nurses, with more paramedics. In terms of the specifics around money, the government has given £1.6 billion to support performance improvements, and it will be used to treat 250,000 more patients in A&E in 2018-19. The NHS planning guidance also shows that they expect performance to improve in the face of growing demand. So that shows how more is being done, more needs to be done.